So the thing about hip pain is that it can actually be within the hip itself. The hip is a ball and socket joint. However, there are lots of structures outside the hip as well. So the most common one that comes to mind is the hip arthritis. That's within the joint. But commonly patients will come to me with pains from their ligaments. You can have small pouches of fluid around the hip called bursae. That's a very common thing to present with. And the thing not to forget is it can actually be referred pain, commonly from the back. So it's quite difficult sometimes to differentiate between the two. So true hip pain is felt actually in the groin or deep in the buttock. And depending on the site of the actual presentation, you can actually be directed as to where the hip pain is coming from. As I mentioned, true hip pain inside the hip will be felt in the groin, and that's commonly hip arthritis. But the other structures, soft tissues around there, can be felt at the front, the side and the back. And the referred pain from the lumbar spine commonly comes in the buttock region at the back. So with any hip pain, we would tend to start with non-surgical options. Simple painkillers, physiotherapy has a huge part to play. And that would usually be the first port of call for anyone with hip pain, really. And then further on from that, if there's a specific surgical focus to go for, then there are operations to commonly replace the hip, which is a very common operation I do, and that would really depend on the level of symptoms and the cause. So the hip area is a very complex area in the fact that there are very important structures around it, nerves, blood vessels, and as such, the risks to them is there, and there's no denying that. So if you undergo hip surgery, it's not without some risk. In the issue of hip replacement, that's one of the most successful operations that exist actually, online with cataracts. The patient satisfaction from hip replacement is very high. So although the risks are great, providing you choose your patients carefully and appropriately, they usually do very well. After hip replacement, we'd normally stay in hospital just for about 2 to 4 days. The aim is to get you walking and comfortable, and most people can get home within a few days or so. It takes another month, 2 months to really get the muscle back and get the strength back, get back to walking, but the initial recovery, a couple of weeks.